Bismillahirrahmanirrahim. And first of all, Happy New Year to all of you. We're so grateful to Almighty that we're still alive in the new year with all the happiness, with good health, and despite all the challenges of last year and our lives, we are here. And this is our first seminar of this year, 2024. And in fact, this is 8th event of CMM, Creative Minds Media, my organization since last year. We launched in March last year, celebrating International Women's Day, and that was also launched. So after that, we delivered 7 events last year, and this is 8th event, 7th, yeah, 8th event. Of course, yeah, I'm just confirming with you. That's okay. Okay. And I'm not going to talk very long because we want to hear Dr. Ghauri. So thank you, Dr. Ghauri, for making it, and thanks to all of you for making it this weather. So I'm really glad we've got a good turnout despite some cancellation. And also welcome to Ms. Kwati. Ms. Kwati is our welfare attaché, and she'll speak to you after when we finish. So Dr. Huma Ghauri, I was like, most of people, they know you already. So Dr. Huma Ghauri, I would just like to give you a brief introduction, but she is much more than what I'm introducing. So you are a GP, senior partner, and a trainer. And you are clinical director of Ardwick and Lockside Primary Care Network. Your practice works on the first, we have IRIS support?
Support for domestic abuse for women.
Support for domestic abuse for women who undergoing domestic abuse, and now most practices will have it, but Dr. Ghauri was the first one to have it. So obviously you're a beautiful lady, a beautiful friend, and a gorgeous wife, and a beautiful mother, and Manchester United fan.
That makes it character building.
Yeah, so Dr. Ghauri, please give it.
Oh. Thank you very much, Farzana.
Thank you.
Assalamu alaikum, everybody. Firstly, thank you very much, Farzana, for inviting me. I've got a vested interest in this area because I was born and brought up here, and now I just work 2 minutes up the road in Dickinson Road as a GP, and I love working here. I love the energy of this area. I'm from here, and I think it's really important to try and put something back and help the people in this area. And I want to give you information today so that if you're in the menopause or if you're approaching that menopause, you can make an informed choice about what to do. I'm not here to tell you what to do, but I'm here to give you information so you guys can decide what to do and what works for you. So I think that's the really important thing. I think your work is amazing. It's one of the first things that I've been invited to talk to Asian women, and I hope it becomes more and more. Because, welcome Sam, come and join us. Because women, and especially Asian women, we lag behind in healthcare. And it's not because we don't know. You're all intelligent, clever, lots of energy and intelligence in the room, but for some reason we don't access screening, we don't access healthcare, and we don't make use of the opportunities that are available to us. And I think now we should be doing it more and more. So this is the reason why I was delighted and accepted straight away when I was invited to talk today. So let's start about what the menopause is. The menopause itself is defined as 1 year after your periods stop, and the average age is 51. But you can have the menopause anytime from 45 to 55. And early menopause is less than 45 years old. But as you know, it doesn't just happen one day, your periods stop and you're in the menopause. We have what we call that perimenopausal period, which can go on for 5 or 10 years before your periods completely stop, where they might become a bit irregular, they might become heavier, they might become lighter, they might become more or less frequent. And you start to get the changes of the menopause, and people don't often realise that that's what it is because they're still having periods, so they think, oh, I can't be perimenopausal because I'm still having periods. And until they completely stop, you tend to wonder if it is the menopause or not. And this is another reason why I think it's important to come and raise awareness about it. So, 51 is the average age, but most women will experience symptoms many years before. It can be up to 5 or 10 years before. So what is the menopause? Here, I don't think my pointer is very good on this screen, but here the ovaries release an egg, comes down, it's either fertilised or it's released as a period. So what happens during the menopause, these ovaries stop producing eggs, you don't get any of the hormone that you need, estrogen and progesterone, and the decline of these hormones causes the symptoms. So people often ask me, why do we get symptoms, that aren't related to sort of the gynae area? Because it's these hormones that have stopped. The thing is that estrogen receptors for these estrogen hormones are located in almost all tissue of the body. So the brain, the skin, the colon, the liver, bone. So when that hormone decreases, it can affect all of these areas. And that's why those menopausal symptoms can affect us systemically in our bodies. It's not just because this has stopped, it's because almost every cell in the body has an estrogen receptor. Lots of our important parts of our body have estrogen receptors. So when we're deficient in those hormones, it causes a problem, menopause. And if that wasn't enough, there's other things that you can get, such as weight gain. And I wanted to talk about osteoporosis, which is thinning of the bones, and we'll come to that a little bit later on because it's very important. Joint pains, and in the perimenopausal period, when you're having periods or irregular periods and you think, why am I getting joint pains? I put it down to the aging process, or I'm getting a little bit older now, not as fit as I was before, and it might be that, but it could also be that you're in that menopausal sort of phase. We talked about cramps, anxiety, and a lot of women, patients will come to me and say, Dr. Ghauri, I could drive at night, but now all of a sudden I'm getting a bit anxious driving at night by myself, or things that you did normally without a problem suddenly become a little bit of an issue. We also know that post-menopause we're sort of increased risk of some cancers. So it's important to know the information and what to do. And 80% of us have symptoms, so that's most of us will have some form of symptom. You might not have them all, but you'll have a few from that list. So it's very, very important. The symptoms can last for years because your periods become irregular first. They don't just suddenly stop. You might have a period after 5 months, you think you've stopped, then you have another one. Things like that. It's not just a straight one day your period stopped completely. 25% of us, that's 1 in 4 of us, have really severe symptoms that can start affecting our quality of life a lot. Not just a little bit, but a lot. And half of the women don't see their GP because they don't think it's due to the menopause. And I'll tell you why. Most women didn't realise the symptoms were due to the menopause because they're a collection of different symptoms. You think, I'm just getting a bit older, or my kids have gone away to uni, or, because it hits you at the time of life when changes occur in your life in general. So children might be going away, parents get ill, someone else gets ill, someone's leaving, and you're just getting a bit older, work's a bit busy, and you just think it's life. You think it's just life and you're not coping as well as you were once. So that's why most people don't relate it to the menopause, especially if you just got anxiety or you didn't get the hot flushes but you got joint pains. You think, what's going on? So that's the importance of talking about it and raising awareness with everyone. And why is it important now? Back in the 1900s, the average age of the menopause was 51, but you didn't live after 59, so you only had 8 years of the menopause, and by the time the real sort of bad effects happened, people died because life expectancy was much lower. Now that life expectancy in 2023, you still have the average age of the menopause at 51, but the average age of death is 85. So that's 34 years without your hormones. That's a third of your life pretty much without those hormones. So it becomes a lot more important and a lot more relevant to try and deal with it and at least know what is going on. And it's a long time, and it's increasing as life expectancy increases. So what we want to do is to help you to understand what's happening to your body, the changes, to distinguish between menopause and other health conditions. Because when's a joint pain a bit of osteoarthritis and wear and tear? When's your anxiety proper anxiety, or is it related to the menopause? And lots of other things. Manage the symptoms so that you guys can plan for your future and make it the best for you. Psychological symptoms we mentioned: anxiety, panic attacks, feeling low, mood swings, feeling frustrated, tearful, not sure why. You know, we've all been there. I think, you know, why did I just shout at my husband like that? You know, or other reasons why. And then it can affect intimacy. You know, you're a bit dry down below, might be tight, you don't have the desire to have intercourse, you just don't feel up to it, you're a bit anxious as well. It can cause strain on relationships and things. And it's important to recognise that, because your body is going through a change. You lose your self-confidence a little bit. Sometimes you think, oh, you know, my skin isn't what it was, my hair's thinning, I'm putting on weight. And all of those things together can suddenly start to make you feel a bit. Before that, you'll see that women, of course we have heart attacks and strokes before the age of our menopause, but it's fairly infrequent, whereas with men it's more. But actually after that menopause, it starts to catch up. You get higher blood pressure, and women ask me, oh, I've got high blood pressure, I can't go on HRT. You can, once it's controlled. It's actually protective of your heart. So increased risk of type 2 diabetes, and as Asian women, we know we're already at that increased risk anyway, and that just pushes it up further. Increased risk of dementia, that brain fog, osteoporosis, we'll come to that in a little bit more detail in a minute, and fractures, and just that general reduction in our bone density, and then you start to cave in, lose height, get a bit smaller as the time goes on. We've talked about problems down below, bladder infections and bowel cancer, because remember, bowel, gut, brain, they have estrogen receptors, so they are affected when our estrogen levels decline. And this is, we were talking about osteoporosis, so this is when the menopause happens, year 0, your bone's okay, it's a bit thicker. Then as the years go down, you tend to get that thinning and loss of that thickness in the bone. So you start to get that curvature in your spine. And remember, it's okay if you were going to die in 8 years, but when you've got another 35 years of your life left, you've got potentially a lot of bone mass to lose. And these fractures and things, they look innocuous, but actually it's a very high risk of illness, mortality. You lose your mobility. You know, it's hard to get back on your feet and to get these things back. So it's important to address it alongside treatment for osteoporosis, which you have to fulfill certain criteria. HRT is the only other licensed treatment. So it protects bone, and we know that, and that's really important to understand. So how do we manage the menopause? That's the key question, because you know, it affects us all. We've talked about why we want to do something about it. It's just for ourselves and for medical health benefits. So what can we do? HRT isn't suitable for everyone. So I'm not going to stand here and say you should all have HRT, no. It's got to be an informed choice, a choice that you make. I want to give you the information to make your own decisions. So it's very, very important not to skip lifestyle changes, because they're even more important at this stage. And for some, that may be all you need. So let's talk about exercise. It's really important as we get older, not just for mobility, but for getting rid of that fat that our bodies try to store. And I have to say, I swapped my Chanel watch for a Fitbit because it tracks your heart rate. And I literally, at this stage, you don't have to get you have to get your heart rate higher. I get women coming to me saying, Dr. Ghauri, I work all day, I drop the kids off, I pick them up, I go to school 4 times a day, I clean the house, I do everything, but I'm not losing weight. And the problem is because your heart rate doesn't go high enough. And you don't have to get it really high. At the age of 50, if you get your heart rate up to 100 and let's say 18 to 25, which really you don't have to work very hard to do it, you'll start to burn fat. So if you do 10,000 steps a day, but you're just walking like this nicely and you're not getting your heart rate up, it doesn't count. You have to get your heart rate up a little bit. So I power walk, and honestly, I don't even have to walk very fast. I have my heart rate on my watch and I get it into that fat burn zone. And that's what I tell my patients, that's what's important to do. And you only need to do, say, 22 minutes, I do half an hour. It's dead easy, it's not hard. And literally to push it up a bit and it starts to work. But it's something you have to factor into your life. Because you're so busy all day, it's very hard to find half an hour sometimes. It sounds easy, but it can be hard with all the other things that we as women manage. And then we talked about diet. Diet is really, really important because you can get natural sort of estrogen-like products from some vegetables and things like that, and also they help with the other symptoms, with the joints. So eating a good diet, and I always say with a balance. You know, I don't come here and say never eat cake, never eat, but you know, a balance. It's got to all be a balance. I always try and put some protein in every meal that I eat. So if I'm having cereal, I'll stick some berries, make it a bit healthier, get protein yogurts, you know, try and put a bit of balance, because life's all about balance, isn't it? If you do super healthy and you don't enjoy your diet, you're not going to stick to it. And if all you do is eat cake and that's not going to work either. So I say find a balance, but think about it. And when I say vegetables, I don't mean how we can sometimes cook the goodness out of them. I mean, like, you know, sort of raw, very lightly. And there is herbal therapies for helping with symptoms of the menopause, because not all women can take HRT. And not all women want to take HRT, because like with every medicine, it's risk-benefit. And we always know that the vitamin D, which our Asian women are very deficient in anyway, especially if you wear hijab because you don't get any sun anyway, and that B12 for energy. These are all evidence-based, well, as evidence-based as herbal things can be. Magnesium at night, red clover, CBD oil, maca, which is a root vegetable. And we know that you can have good and bad bacteria in your gut. The good bacteria are going to help. Black cohosh is a naturally occurring estrogen, phytoestrogen as we know it. But we don't want our bodies, if we've got uteruses, to have estrogen without protecting our endometrium. So I'm not sure, you have to be a little bit cautious. Mushrooms are getting a good press at the moment. For protein and essential amino acids, ginkgo biloba and St. John's wort. These are all stuff that are known to help with menopausal symptoms that you can get from a herbal therapy shop like Holland and Barrett. Sometimes they interact with your medication if you're on other medications, so you need to check if you're taking other things with your pharmacist. But they have a good place, and it's certainly something to consider. And if you're not having a good multivitamin, then think about it. Turmeric's meant to be another one that's meant to be good.
I've heard soya is also good for estrogen.
Yes, it is, but it's about how much estrogen do you need, and it's not regulated. But these are all things that help in moderation. So then there's non-medical therapy, which is just good for the soul as well as helping with these symptoms, isn't it? So acupuncture, CBT can help manage that stress and anxiety. aromatherapy, reflexology, we have acupuncture. All of these things have a role, and for some people that may be all they need. Doesn't mean that's for everyone, and you just pick and choose and get to know what's right for you. Then of course is HRT. So what is HRT? Someone asked me about it this morning, and there's lots of people that don't know. So HRT is what it says, it's hormone replacement therapy, and it improves the symptoms because it's replacing the lost hormones that your body stopped producing. So the estrogen and the progesterone, it really helps with those. And you can get it in lots of different forms. You can get it in tablets, patches, gel, spray, part of a coil. I won't go into it too much, but if you have a uterus, you need estrogen and progesterone, basically in a nutshell. And if you don't, if for example you've had a hysterectomy for whatever reason, then you just need estrogen. Most of us would need estrogen and progesterone. And the estrogen we usually give in a gel or a spray or something like that, because it goes straight into the system. You don't need high doses of it, and it's quite easy to control. You can titrate it up or down depending on what your woman's telling you and what symptoms they've got. And I think I found my spray. Let me just see if I can find, there we go. This is one of the sprays. It's as simple as that. You just take it off. I'm not going to do it now. Spray it here or on your thigh. Done. So that's mine. I use a spray, and I have a tablet because I've got a uterus. And everyone else can be doing something different. We can use gels, we can use patches, we can use a combination of things. It's really quite easy to do, and it helps with all those symptoms. It gives you bone protection, which is really, really important, especially not now, but in 5, 10, 15 years time, when you've had no hormones for a while, the importance of these things kicks in a little bit more. So, the benefits of HRT, and this is evidence-based benefits. This is not just me telling you, this is lots and lots of research. If you go, these are what we call body identical hormones. They've had lots of research done. They're as close to as what we naturally produce from our bodies ourselves. If you go to all these private clinics, you can still get hormones, and they're called bioidentical, but they're not evidence-based. They don't have as much research behind them, and I would definitely stick, well, you can see I do, stick with what your doctor can prescribe, or what's proper body identical hormones. It reduces your risk of heart disease, of the bone we talked about, dementia, osteoarthritis, bowel cancer and obesity, because you're replacing that estrogen and your body isn't having to store those fat cells to get the bad estrogen from it. The impact on the quality of life for most of us is moderate to severe, and it's important to do something about that. It can be treated, that's the good thing. There's lifestyle changes which are very important. HRT is safe. It has some risks, there's nothing without risk, and we individualise that for a person. So your risk might not be the same as your risk, might not be the same as my risk. And we sit down and we discuss it with you when you come. If you say, look, I'd like to try HRT to your GP, they might give you a questionnaire to fill in to see what impacts you the most with it, and then they can discuss treatment options and the risk. And we can talk about that if anybody has any questions. And my thing is, don't suffer in silence, because you might not want HRT, but you might want the herbal stuff or something like that. You might take it as a moment to start addressing your lifestyle and changes, and it can really make a difference. And I like this slide because nature decided that pregnancy, labour, delivery, breastfeeding, stretch marks, saggy boobs and cellulite wasn't punishment enough. We got the menopause as well. So I just wanted to say thank you for listening, and I'm happy to take any questions.
Can I ask a question? It's quite an intimate one, but something that worries me quite a bit.
Sure.
And I don't think this one needs to be.
But it only goes up by, I think it's 2 or 3 in over 5 years. But if you exercise half an hour 3 times a week, you bring your risk down by 5. So in my head, I think, from the baseline population, my risk's gone up 3 because I'm taking HRT, but actually it's gone down because I'm exercising. So in the end, I'm still better than the baseline. And I think it's important to work out individually what your risk would be with HRT. The biggest things that will push your risk up is alcohol and obesity. If you're just overweight and that's a BMI of above 30, from my memory it might be 35, and that pushes your risk up way more than taking HRT. So that alone pushes your risk up more. So HRT, and also it protects as well. So it's protecting you from colon cancer, it's protecting you from dementia, it's protecting you from heart disease, and you can manage your risk of breast cancer. So there's not no risk, but it's about getting your head around the risk and knowing what works for you and your individual risk. I don't think it's related to the pill, because when you're on the pill you have a slightly increased risk, but when you come off it those risks go back down to baseline pretty quickly. It's unlikely to just come off the pill and go straight on it. And then HRT has its own individual risk, but it's very low.
But you're not increasing the risk if
To
you
have one and then the other.
No.
Can't be delayed in terms of when your body decides it's going to the menopause, it's going into the menopause. External factors can influence it. So, you're talking about stress, I'm thinking about treatments for cancer or radiotherapy or various other things. They can put you in an earlier menopause, but then we would replace that with hormones, because you naturally have those hormones. Very, very important if you're younger. If you go into the menopause at the age of 30 or 40, you want to protect your bones at least until everyone else on average would go into the menopause, so till you're like 51 or thereabouts.
That was wonderful talk, thank you so much. I'm going to thank you again. But before we close this discussion, I have a concern, because being as a community activist, and I hear lots of stories of relationship problems. We have discussed that before. But what advice would you like to give to men to understand the problems of menopause, that their women actually going through menopause, that they need to be empathetic, they need to look after themselves? Because our men, they need a lot of awareness about this. I wrote an article last year about the menopause, giving some basic information to everyone has read from Google, and giving men advice. They should not look elsewhere, because that's where things go wrong. And they complain. I hate them stories, but they complain that the women, they're not getting on well with each other. Women are feeling irritable, and they're snapping on them, so they have the relationship issues, and they're falling out with each other. And what they do is then they look elsewhere. So things go wrong then. So they really need to understand what advice would you like to give. Because this recording, we are recording this and it will be uploaded on our YouTube channel. So they will be watching it. I've not recorded the questions. I've not recorded the questions. So we just recorded your talk by all of this very good say.
Okay, so what I'd like to say to men is that menopause is real. Okay, it's real. It's a change for women. It's a big, massive change for them. A change in their hormones. So the symptoms that they're feeling, they're not made up. They're real and they're feeling them. And so be empathetic and talk to them about it and see how you can help them. And work with them. Increase the self-confidence of your woman rather than complain or moan about it, and try and work through it together and help your women and support them in getting treatment and going to speak about it, and don't just say, oh, it'll pass. It can be real and it can last a long time. So that would be my advice.
Thank you so much, because they don't seem to understand what women are going through. So that's been very helpful.
Thank you very much. I've really enjoyed coming.
And it's a good gathering, because we have learned a lot about menopause, which every woman has to go through later or before. And That is, and my message is better integration. I have seen the ladies over here who speak in English, who seem well integrated with the English society over here, and I'm happy, and I want all women of Pakistan should get the opportunity which this country is offering, and I want all the women to come to me in case they are facing any kind of problem which is related to the government of Pakistan, because I am a link between community over here and Pakistani government over here. I'm basically appointed over here to solve these problems. This is my very small message. Inshallah, I will keep on talking to you on various other on various other gatherings. But at present, I think it's good. Thank you so much.
Thank you.
Do you have a question? Yeah, we can get that.